herniations in athletes and what you should know if it happens to you or a loved one. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical, and the topic that this video covers is really a big deal for so many people. Disc injuries are the most common reason we see people in our clinic for back pain. Now, I'm sure someone you know needs this info, so make sure they get it. From the top, it's important to know that we see and successfully treat lots of athletes in our clinic suffering from all kinds of extremity, neck, and low back issues. Like I said, disc pain in the low back is the most common. And so these things, it's just what we do. And when we're discussing disc herniations in athletes, we are firmly in our wheelhouse. That's what we do. Let's start by defining a disc herniation, shall we? The discs are little shock absorbers between the bones, also known as vertebrae, if you know a little bit of anatomy, but they're shock absorbers between the bones of our spines. The shock absorbers are made up of rings of cartilage on the outside with kind of a jelly center, sort of like a jelly donut, if you will. A herniation is basically when there's a weakening of that outer ring of cartilage, which can allow the jelly to push through a bit and cause irritation on the nerve root that passes through that area. And this can hurt. It can hurt a lot, as in more than you have ever hurt in your life. I promise you didn't know you could hurt as bad as a disc herniation and nerve pain that comes from it. Oh man, it will get your attention. It'll get your attention. It can potentially cause loss of function and other issues as well. Although something like a loss of neurological function, something on that level is really more rare. Now there are non-surgical as well as surgical options for something like this. And thanks to more current research, when there is no loss of function neurologically, then we know that non-surgical options are 100% the first line preferred treatment recommendations. So let's fly in the face of traditional medical thinking even further by saying that research also suggests that up to 70% of symptomatic patients improve with conservative care. Discs just have a tendency to heal up, and the right kind of conservative care, we can help that happen more rapidly. For obvious reasons, athletes experience disc herniations more commonly. They get a lot higher stress on the body. They're doing a lot of stuff that the regular person just doesn't do. And while surgery is sometimes the best option when there's a neurological functional loss, conservative care, like the care you'll find right here at Creekstone Integrated Medical, can get these athletes back into the game that they love without any significant setback. There was a paper that included 799 patients that had surgery performed on them because they had a disc herniation. And the paper also included 308 patients that did not have surgery for their disc herniations. And instead, that group, the non-surgery, the no surgery group, they had physical therapy and low-grade meds like ibuprofen. And so these researchers concluded that 83% of the surgery group came back to play the game they love. At the same time, 81.5% returned to play from the no surgery group. So 83% came back after surgery, 81.5% came back after no surgery. So the paper went a little bit further, and they showed that the average time that it took for them to return to the game with no symptoms was 5.19 months for the surgery group and only 4.11 months for the no surgery group. And they said, quote, "This study revealed that there is no statistical difference between the return to play rates in both groups. And based on this information, it is safe to say that operative care, surgery, does not have faster return to play than no surgery or the non-operative management." That's powerful, people. That's really, really powerful. Certainly when your athlete is young and developing, and not to mention the college athlete that's hoping to step into the pros. And then you've got the pro that has millions of dollars on the line every time they step on the field. We have several ways of treating disc injuries right here at Creekstone, y'all. One of the ways we approach disc injury is through McKenzie methods from the famous physical therapist Robin McKenzie. We also employ spinal decompression and low-level laser and exercise physical rehabilitation as well as neurodynamic exercises and stretching. And while we are extremely successful at treating disc injuries, it all starts with the diagnosis. Having a fellowship in orthopedics and neuromusculoskeletal medicine helps me get to the most accurate diagnosis quickly and direct the treatment effectively and efficiently. If we can help you or your loved one, call Creekstone Integrated Medical at 806-355-3000. Let's get you some help. Let's get you back in the game. If you're watching on social media, do us a huge favor. Like, subscribe, share, comment, and all of the other things. It makes a big difference in the long run. Until next week, stay smart. We'll see you then.